Welcome to another episode of Med Madness, where we dive deep into critical medical topics that matter. In today's episode, we'll be exploring reactive attachment disorder, or RAD, a condition that affects some of our most vulnerable patients, young children. RAD can have profound impacts on a child's ability to form healthy relationships and develop emotionally, especially when they have experienced significant early life trauma, such as neglect or abuse. We'll unpack the clinical features, associated difficulties, differential diagnoses, and effective management strategies. Stick around because we'll also walk through a brief case study that ties everything together. Next, let's discuss reactive attachment disorder, or RAD, which is a serious condition that typically emerges in children under the age of 5 who have experienced insufficient care. This might include situations where the child has been neglected, abused, or subjected to inconsistent caregiving, such as frequent moves between foster homes or prolonged institutionalization. Children with RAD often exhibit profound social and emotional withdrawal. Unlike other children, they do not seek comfort from their caregivers and may not respond when comfort is offered. This lack of social responsiveness can also manifest as limited positive affect. In other words, they may show very little joy or happiness in interactions. These children might also display unexplained irritability, fear, or sadness, even in safe and non-threatening situations. Moving on, let's talk about the associated features. RAD doesn't just stop at emotional withdrawal. It can be accompanied by a range of behavioral issues such as difficulties with toileting and sleep, as well as more generalized symptoms like anxiety, aggression, and hyperactivity or impulsivity. Differentiating RAD from other conditions can be challenging. Autism spectrum disorder, for example, also involves social deficits, but RAD lacks the repetitive behaviors and restricted interests typical of ASD. Post-traumatic stress disorder might be considered, but PTSD usually includes re-experiencing trauma and hyperarousal, which are not characteristic of RAD. Other conditions like adjustment disorder, disinhibited social engagement disorder, and various anxiety and depressive disorders can also be mistaken for RAD, so it's crucial to make a careful and accurate diagnosis. The good news is that with early intervention, many of the symptoms of RAD can be improved. The cornerstone of management is providing a safe, stable, and enriching environment, along with consistent and responsive caregiving. Psychological services, including parenting skills, training, and family counselling, are also key components of treatment. By addressing the root causes of the disorder, namely the child's early experiences of neglect or abuse, it's possible to help these children develop healthier attachment patterns. Let's consider a real-life scenario. A 4-year-old child was placed in foster care after being removed from a home where parental substance use was rampant. Over the course of several months, caregivers noticed that the child was unusually withdrawn. Attempts to comfort or engage the child were met with indifference, and the child showed little to no positive emotion, even during playtime. The child also had frequent episodes of unexplained irritability and fear, particularly in situations where there was no clear threat. After a thorough assessment, the child was diagnosed with reactive attachment disorder. With the introduction of a consistent, nurturing foster environment, along with psychological support, the child slowly began to show improvements in social responsiveness and emotional expression. Over time, the child's ability to form healthy attachments to caregivers began to emerge, illustrating the potential for recovery when the right interventions are put in place. In summary, reactive attachment disorder is a condition rooted in early life trauma that can have significant and lasting effects on a child's emotional and social development. However, with early, consistent, and nurturing care, children with RAD can overcome many of these challenges and go on to form healthy, secure attachments. As always, we encourage you to engage with our pre- and post-podcast quizzes to reinforce your understanding of today's topic. And don't forget to check out the Anki flashcards we've created to help you study more effectively. Thanks for listening to Med Madness. Stay curious, and we'll see you in the next episode.